After these great talks, theoretical introduction, the concepts of molecular connectivity, I would like to get a bit more hands-on and talk a bit about the methods in molecular connectivity, with specifically a focus at the single subject level. We saw a lot of results at the group level. The question is it possible to get at a single subject level, which I guess would be of interest for many of you, since at group level, of course, yes, we can understand mechanisms of disease, but maybe we want to get at single subject level to have biomarkers that we can use for diagnosis, prognosis, and treatment evaluation or selection. So actually, when I was preparing this presentation, I realized this talk should be done in a tutorial of probably 10 hours. This will be condensed in 15 minutes, so lots of slides. If you want to take pictures, be fast, because I have to be fast. So first of all, these are the references I will use during these presentations. Some of them you already saw. You want to take a picture? No, I can continue. Okay, outline. So I will go through the approaches to molecular connectivity. You already heard about them from Daniela and Igor, but I will just go back to it again. Methods. And finally, we will get to the single subject measures. So for the approaches, as you heard, we have different types of approaches. I will not go into the very fancy, weird other ones. Let's say there is intra and inter-subject approaches to study molecular connectivity. At the intra-subject level, so we have one subject for which we have different measurements in time. Let's say we want to study the connectivity between the thalamus and the occipital cortex, so we measure the uptake in these two regions at time 0, and then again time 2, 3, 4, and so on. What we get is a time series, and we want to measure the consistency in activity, in the variation of activity between these two time series in one subject across time. Other option is to go, as you heard, at the inter-subject level. So in this case, we don't have just one brain, but we have many subjects. And again, we want to measure the same thing, connectivity between thalamus and occipital cortex, but this time on the x-axis, we don't have time, we have subjects. So we measure, again, across subject. In the first subject, what is the uptake in these two regions? And again, in the second subject, third, fourth, fifth, and so on. So here we are looking at the consistency in the signal of these two regions across subjects and not across time. How can we do it? So what kind of PET data do we need to do these two things? So at the intra-subject level, actually I realized there is a lot of different approaches. The literature has been very creative to do things at intra-subject level. One way to do this is to ask the subject to come at the PET scanner multiple times in time. We do one measurement per time. Let's say we measure FDG PET, and we just acquire one image, one frame each time. This is done, as Igor already showed, across many years, for example, in this case. So in this case, we have one single subject, one participant being measured between 5 to 9 times through the years. This is not yet published, but if you go to this QR code, you have a video with a presentation of these results at a symposium we did 2 years ago with Xin. So this is multiple sessions. This is a very, very long time scale. But we also have an alternative, which is, again, to acquire. We make the subject come just once. We do just one scanning session, but we do multiple runs per session. This is, for example, the case of water PET, when we measure perfusion. So we essentially inject the tracer once, measure for 2 minutes, and then we inject again and again and again. And here you have an example of this approach being used in a subject that was in a vegetative state. And it was possible to compute connectivity between the thalamus and the frontal cortex when the subject was in a vegetative state. And you see here in red, there is a negative correlation, connectivity between these two regions. And then in the same subject, in one session, after he had recovered consciousness, and we had a positive correlation between these two regions. So it's, again, within subject, just one session, but multiple runs are done per session. This is possible only with certain types of tracers, because you cannot inject FDG PET multiple times in one day because of the longer half-life. More complicated is to use instead dynamic PET. So the subject comes just once for one session. We do just one injection, one single run, but we acquire a time activity curve. So we have multiple images in one subject, and we can apply compartmental modeling to estimate how the tracer behaves in our regions of interest. So we have two time series so we have multiple frames that constitute the time points in our time series, and we can estimate inter-subject connectivity. Finally, the last point that Igor already mentioned is the case of functional FDG PET, where we have a dynamic acquisition but with constant infusion. Instead of injecting a bolus injection, so we do the injection in a few seconds, we keep injecting tracer, so we have a constant infusion of tracer in the plasma of the subjects over the full acquisition. So here is just one single session, and we can measure the variation in the uptake of the tracer through time. And you can see here, for example, this method is sensitive to detecting variations, for example, during tasks. So during a visual task, we will observe differences in the uptake through time in the occipital cortex with actually pretty huge variation. The signal increases of 25% on average when you do this task. So this is also possible. This gives us a time series to do inter-subject assessment. The easiest way, though, is to go at the inter-subject level. Here we don't need these complicated acquisition protocols. We just do one static acquisition, 10, 15 minutes, depending on the sensitivity of your scanner, and we have one image per subject. Of course, just one image per subject, we cannot do anything at the inter-subject level, so we have to go inter-subject. And here you have many examples, like again, the study by Xin, which also actually assessed connectivity across individuals. So these are the two options that you have. This one has been much, much more common, so that's why you heard a lot also from Daniela about this kind of approach, but these also exist, and it seems that their interest is kind of going a bit towards the intra-subject assessments. Whatever your data, so whatever you want to do inter or intra-subject estimation of connectivity, you actually need to apply more or less the same methods. And just one disclaimer, all the knowledge of connectivity that we have relies on the assessment of covariance of correlations. We are looking at how much our signal covaries as compared to its own mean. This is not the only way to do it. There are more than 200 different metrics that one could use, but so far, this is what the literature has done. If you go into the EEG literature, you will actually see that they use many more different metrics of connectivity. But so, this is what we use. So is methods based on covariance. You can compute, for example, Pearson correlation coefficients, peer correlation coefficients, or other variations of those. There is three main classes of methods. As you already heard from Daniela, we have seed-based interregional correlation analysis, where you are interested, in this case, in a specific seed region, a region of interest that you have to select. You extract the uptake in these seed regions of interest. In this case, it is an example for inter-subjects, so either across subjects or across time, and you have an estimate, this connectivity map, at the voxel Y level of your own region. So this is the pattern of connectivity that these specific regions that you selected has with all the rest of the brain. The map is then thresholded, and you can get this kind of patterns. You can estimate resting state connectivity networks with appropriate selection of seeds. So it is possible to assess resting state connectivity integrity with seed-based interregional correlation. The other category is the independent/principal components analysis. Here the premise is a bit different. We are taking the whole brain. We are not selecting anything, and we want to know how, let's say, what are the components underlying this signal. So how can we decompose these signal to have, let's say, components, so let's say topographical, let's say clusters of regions that tend to covary together and don't covary with the rest of the brain. There is some differences between independent principal component analysis. I don't have time to go through it, but you can read a bit more in the reference here. So here we have the full brain, and we decompose the signal to identify different components. These components are then thresholded, and we get this kind of patterns. If you do independent component analysis, what you say that you get is resting state networks, like the default mode networks, the silent networks, and others. If you do principal components analysis, since the method is a bit different, usually what you say is that you get a pattern. And it's something I think that Matej will discuss more about later. Finally, you can also do correlations at the regional level. So you select your regions of interest. They can be covering the full brain or just cover a specific circuit. And you assess the correlations or partial correlations or whatever metrics you want to use across different regions. So you have, let's say, an overview of the relationship between each regions with all the others. This can then be converted, let's say, it's more a visual thing into, let's say, a connectome. And on this connectome, one can do different kinds of analyses, estimate graph theory indices, or whatever you would like to do. It does not have to be done at the whole brain level. You can select just a specific circuit that you are interested in and do it on 2, 3, 4 brain regions. This is a summary. So just to give you an overview of, let's say, the different starting and end points of the different methods. As you can see, now I will not go through all of these, but just as you can see, there is different levels of user interventions. And I would just like to caution you about the impact of your methodological choices on your results. Of course, when you do a seed-based analysis, you have to select your seed of interest, and you have to select the metric that you will use to estimate connectivity, correlation, partial correlations that can make a difference. Similar at the ROI to ROI level, there is an impact of the choice of your ROIs on your results. It has been proven that if you use different atlases, you will get different results. The point is not really about using different atlases. The main point is about granularity. So if you have a very coarse atlas with very big regions or an atlas with instead very detailed small regions, your results, as well you can imagine, will be different. So let's say you need to be aware of these, and as a recommendation, you should try to replicate your results with different atlases. Here, these two methods are a bit more data-driven, so you really use just the data as they are. It's a whole brain, but still you have to make a decision on the algorithm that you will choose that will impact on your results. And you have to, sometimes you have to select the number of components you want to extract, and sometimes you have to select the components that you get. So not all components that you get make sense. Some components are just noise. Some components are physiologically meaningful, but it's up to you to decide which is which might not be non-trivial, but there is some atlases and guidelines to do that. Finally, the most important part of the talk, getting at the single subject level. So as you can imagine, if you apply these methods that I just showed, using an intra-subject approach, so you have time series, of course, these you can do at the individual level. So automatically, yes, it is possible to obtain an individual estimation of connectivity. Quite surprisingly, though, most of the papers that I was looking at, they don't really do it. So yes, they estimate first connectivity at a single subject level, but then the results that are shown at a group level. They show just an average of the individual results, which is kind of surprising. So there is really not much, I would say, not much is known about this. So can we actually use these measures as actual working individual measures of connectivity or not, as maybe biomarkers one day? Really, we don't know. One example I want to show, a very old study based on seed-based correlation, where actually they do show results at the intra-subject level, and they have to do it because in this study, what they assess is subjects that have had some upper limb amputation. They have very different types of, let's say, damage, and they also have a remapping of their sensory perceptions from the lost limb to different areas of the body. So the clinical phenotypes of this subject is quite different, which means you cannot put all these subjects together into an inter-subject analysis because just these subjects don't exactly belong to the same population. So here, when heterogeneity is high between subjects, you have to, I would recommend to use an inter-subject approach. And here they show how this is the pattern of connectivity. This is a seed-based analysis. This is the pattern of connectivity of the primary sensory motor cortex. As you can see here, this is the healthy side of the body. And here is the pattern of connectivity of the sensory motor cortex that there has been the phenotypical behavioral sensory remapping. And this remapping is also shown here. With this area, the primary sensory motor cortex, actually now connecting to a higher proportion of areas along the sensory motor cortices. So this is again done at the single subject level. And honestly, it's the only example I could find, but again, to the best of my knowledge. At the intersubject level, it's a bit more complicated. So with state-based analysis, we cannot really go to the single subject level, but as Daniela showed, we can do something called psychophysiological interaction that allows you at least to model some clinical or cognitive variables into your data. So you can see connectivity co-varies with these clinical variable of interest, but you can derive a single subject measure. If you use independent component analysis, instead you can get to the single subject measure, you can derive loading coefficients, and Igor already explained this paper, I will not go through it again. So here we derive some resting state networks at the group level, but then we can extract a loading coefficient which gives us a measure of the resting state network's integrity at the individual level. And Igor proved that this measure can be used as a biomarker. So it works. You can distinguish patients with Alzheimer's disease dementia, frontotemporal dementia, and controls if, for example, you consider the loading coefficients of the posterior default mode network. Okay, so this is the independent components analysis. We have also principal component analysis. This is the job of Matej to explain. He is the expert. I will not go through it. Of course, I guess you know of these very nice papers that he published, so you can look at it if you're more interested. Finally, in case of ROI to ROI correlations, this is a bit more trickier. So is it possible to get to the single subject level? So right now there was one approach that was proposed around 3 years ago, where you start from a group level correlation coefficient matrix, but then you look at the uptake in the individual patients to derive a weighting matrix and essentially derive an individual connectome from this group level matrix based on the deviation from the average of the group. It's a kind of an experimental approach. I never saw it replicated. Maybe it will become more, I don't know, maybe it's something to look into for the future. So in summary, can we get at a single subject level the molecular connectivity? So, well, if you use an intra-subject approach, yes, this is feasible. It can be a bit challenging to set it up. As you saw, these methods require multiple sessions or multiple runs in a session, or more complicated modeling with dynamic scans, constant infusion scans. Also, something I did not mention, but I think it's important to stress, is that in these methods, either you have a low number of data points, because you cannot scan your subject 10,000 times because of radiations, or if you use these more dynamic methods, you tend to have a low signal-to-noise ratio because your frame will be quite short, so you don't get a very nice image in such a short amount of time. At the intersubject level, well, can we go at a single subject? It is feasible, at least for some methods that I showed. It's an easy setup. It's just a standard clinical static acquisition, but we need to be kind of sure that our subjects belong to the continuum, to the population we are measuring. If we have a very heterogeneous population of patients, maybe it's a bit more tricky to do this. So finally, there is a lot to do. As Igor said, we need to validate, we need to study, we need to learn about the impact of the methods on our results. So, well, it's a new field of research. And again, thanks to my colleagues for their support in, well, everything I showed. So, and thank you for listening.